All right, we're going to go ahead and get started because we do have some introductory slides. I want to give Dr. Wallace enough time to talk about this very important topic. So welcome everyone. My name is Elena Kidd and I'm a program director with the University of Alabama at Birmingham School of Public Health in the Office of Public Health Practice. I'm excited to welcome you to today's webinar, Pandemics, Infodemics, and Information Overload, how consistent, clear communication can help in future outbreaks, featuring Dr. Katrine Wallace from the University of Illinois at Chicago. This webinar is made possible by the Alabama Regional Center for Infection Prevention and Control Training and Technical Assistance, or ARC-IPC. The ARC-IPC was established to meet the consultation and support service needs surrounding infection prevention and control throughout the state of Alabama. The center is a collaborative effort of the Alabama Department of Public Health's Infectious Disease and Outbreaks Division and the University of Alabama at Birmingham. The ARC-IPC provides training and technical assistance to infection prevention and control and public health professionals in areas needed to detect, respond to, control, and prevent infectious disease outbreaks. You can learn more about the center, view and listen to past webinars and podcasts, sign up for our newsletter, or request training and technical assistance, or view our resources at uab.edu/ARC-IPC. You can also email us at arcipc@uab.edu. We'd like to thank our co-sponsor for today's webinar, the Region 4 Public Health Training Center. You can learn more about their programs and center as a whole at the website listed on the screen. And finally, it's my pleasure to welcome back our speaker, Dr. Wallace. Dr. Wallace holds a PhD in epidemiology and has at least 15 years of experience in research, epidemiology, research design, pharmacoepidemiology, health economics, outcomes research, and biostatistics. She is currently an epidemiologist and adjunct assistant professor of epidemiology at the University of Chicago, at the University of Illinois at Chicago School of Public Health. She is also known as Dr. Cat on her popular social media channels, where she educates on epidemiology, vaccines, and the COVID-19 pandemic. She has been an invited speaker into the US and internationally and has presented research at over 20 scientific congresses. A vaccine advocate, she serves as a member of Team HALO, United Nations Verified Initiative, Project FIDES, World Health Organization, and she was chosen as a vaccine luminary for the 2021 G7 Vaccine Confidence Summit. Dr. Wallace has also been featured as an opinion contributor for The Hill and has been interviewed and profiled in several mainstream media outlets such as the BBC World News, the Washington Post, Good Morning America, Bloomberg, CBS News, and National Public Radio. And without further ado, it's my pleasure to introduce Dr. Wallace.
Thank you so much. I really appreciate that nice introduction. And I am going to dive in because we have a lot to cover. This is a topic that is really near and dear to my heart. If some of you have seen my other two webinars that I've done with UAB, I have done one on misinformation, just kind of the problem and how it contributes to how it exacerbated the COVID-19 pandemic. And then I had a second one where we talked about strategies to combat misinformation. So this is sort of like a part 3, where we talk about kind of the whole pandemic as a whole, the infodemic that we had, and information overload and the problems that caused. So this is kind of almost like a postmortem, part 3, if you will. So today, what I want to take care of in this presentation is I want everybody to know what an infodemic is, how they harm public health. We want to discuss misinformation and correct information and how they both can contribute to infodemics, how strategies, and then understand some strategies we can use to mitigate public confusion and information fatigue. So let's just do a little background on infodemics. So it's a new word probably for some of you. So an infodemic is defined by the World Health Organization as having too much information, including false and misleading information in both digital and physical environments. So it's in both social, it's not just a problem on social media. This also exists in people's real life world. So during a disease outbreak, we have too much information circulating, some of it correct, some of it not, all of it confusing, because when people try to seek information either from individuals or online, they get sometimes conflicting narratives and conflicting stories, which causes people to just kind of check out, right? So during COVID, we had a bolus of conflicting information, data, and yes, opinions from people that weren't probably people that should be talking about COVID, about the virus and its prevention measures. And it led to a lot of public bewilderment and message fatigue. And this drawing kind of reminds me of how a lot of us felt during this time. So infodemics cause confusion and risk-taking behaviors that will then cause harm health, because people just kind of check out and do nothing, right? And the infodemic leads, importantly, to mistrust in health authorities, and it also undermines the public health response. So an infodemic can actually intensify or lengthen disease outbreaks because people are unsure what they need to do, because they hear all kinds of different messages and all kinds of different information, right? So when it's down to what they need to do to protect their health and the health of the people around them, they may just do nothing or not know the right thing to do. And one problem that's new kind of to this is that we have this growing digitization of our lives. And because of this, we've had this expansion of social media and internet use, and this causes information to spread way more quickly than it ever has before. So this can help quickly fill information gaps that are needed, but it can also amplify harmful messages, right? So there's two sides to the same. So the digitization of information is both good and bad. And algorithms online, which we'll learn about a little bit later, also reinforce echo chambers and polarization of information. So I was talking a second ago about how infodemics damage trust. And this was a survey done in September of 2023. And it just talks about like how much people trust the following to provide reliable information. And people were asked about like their doctor, pharmacists, the CDC, the FDA, and so forth. And 15% of people said they don't trust their doctor at all, or they don't trust them much. 36% distrust the CDC, 32% distrusted their local health department, and 38% distrusted the FDA. So this is definitely a new survey that just came out. This is like sort of a temperature that they take. This survey was done by the Kaiser Family Foundation, and I have a lot of data from them in here because they do a lot of good research that's it's not necessarily peer-reviewed studies, but it does take temperatures of what's going on in the population and sentiments about vaccines, about people's attitudes, things that are data that aren't necessarily collected with vigorous research during the pandemic. So they filled a lot of gaps with the surveys they did, and their survey is called the KFF Vaccine Monitor, and there's a lot of really great data in it. So that data that I just showed was new data. So you might be wondering, well, how has that changed during the pandemic? How has the infodemic caused that to be, has it caused that, or is it the same, or how has it changed? And so this is another KFF graph that just kind of shows that the trust is lower now than it was before the pandemic. These dots on this graph, so the dark blue navy dot is December of 2020. So like during the first year of the pandemic, the royal blue dot in the middle is sort of June of 2021. And the light blue dot is April of 2022. So you can see this progression to more distrust over time during the pandemic. As the pandemic went on, there was less trust in the CDC, the FDA, Dr. Fauci, and the president during the pandemic because of all of this conflicting information going on. Echo chambers online also amplify misinformation, which leads to more mistrust among certain groups. And you can see that in this graph, you can see that Democrats and Republicans were very different in the way they rated their trust of these organizations and people. So this is because they're interacting with different information online. And you might think, okay, well, that's COVID. And yes, COVID was a problem with information, but what about, but you might think the rest of the medical information is fine, but it's not fine, because if we just think about trust in vaccines in general, the misinformation about COVID vaccines has bled over into trust in any vaccines, and childhood vaccines on the pediatric schedule are at risk of becoming not obviously done away with, but less people are wanting to get them and understand the importance of them, and more people are kind of backing this medical freedom idea of like, we should be able to choose if our children get vaccinated or not. So it's sort of a political argument of medical freedom rather than a scientific argument, right? Where we know that vaccinating kids for measles, mumps, rubella, and other, infectious diseases actually leads to more health in the community. So it's science argument versus a political argument, right? And trust in vaccines has decreased across the board. So this survey shows that the percentage of respondents who believe that parents should be able to opt out of MMR vaccines actually increased between October of 2019, before the pandemic, and after the pandemic. So in December of 2022. So this was kind of eye-opening data showing that the information that was spreading about COVID vaccines has damaged trust in other vaccines as well. So if any of you pay attention to my social media accounts, you know that misinformation and disinformation is one of my missions to debunk misinformation and to promote good information. And I think that misinformation played a humongous role in the infodemic and how narratives were formed, right? So the Surgeon General of the US in 2022 put out a misinformation toolkit to kind of help people educate on misinformation. And the definition of misinformation in that toolkit was any information that is false, inaccurate, or misleading according to the best available evidence at the time. And that's really important, right? Because you can't really retroactively assess information with current evidence that you maybe didn't have at the time. A good example, and the reason I have the child in the mask on this slide, is because at the very beginning of the pandemic, people love to talk about how Dr. Fauci said we didn't have to wear masks at the beginning. So then he told us we did. So he lied before. So really what happened was we didn't know about asymptomatic spread at the beginning of the pandemic. We were assuming it was like the flu, where it's most contagious during the viral load is highest during the symptomatic period, right? So we didn't know that. So when we learned that, then the information changed and then the guidance changed, right? It wasn't that somebody lied before. So people like to, be argumentative and say that public health folks and scientists also were spreading misinformation back in like 2020. But really, we learned a lot over, this was a novel virus, and we learned a lot during 2020, 2021. If we only knew what we knew now back then, we would be in a much better place, right? But we didn't, and we didn't have that luxury. So also, misinformation is spread a lot of different places, right? We've talked about social media, and we'll talk about it a little bit more, but it's also posted on, text messages. Group chats is a very big one, like WeChat and WhatsApp chats. A lot of people join these WhatsApp groups that will share misinformation, and it's very hard to monitor because you have to be a member of that group to be getting these messages. So it's really hard for an agency like the WHO or the CDC or something to monitor that information. So misinformation is also not new with COVID, right? We've had misinformation for as long as we've had information. And a vaccine example from 1802 is this drawing of the first smallpox vaccine was using the cowpox virus. So cowpox and smallpox are very similar viruses, only cowpox was less deadly. And people noticed that milkmaids who worked with cows, when they were milking the cows and were exposed to cows with cowpox lesions, then didn't get smallpox. It was an observation that was made. So people thought, okay, exposure to this cowpox virus, causes some kind of immunity also to smallpox, this really deadly virus. So let's try using that as a vaccine. So they did, and it was successful, right? But there was all kinds of misinformation, and this cartoon depicts people turning into cows after being vaccinated for smallpox. There was also rumors that women who were vaccinated for smallpox would then give birth to half cow babies and things like that. So there was all kinds of things. But in reality, of course, thanks to vaccines, smallpox has now been eradicated from the globe. So this just shows that misinformation did not start with COVID. It started way back, and as far back as we can remember. And belief in COVID-19 misinformation during the pandemic was much more common than we might have thought. So asking just a survey of people, another KFF survey, nearly 8 in 10 people believed or were unsure about at least one common falsehood about the COVID-19 vaccine or COVID itself. And these things were like, that you can get COVID from the vaccines cause infertility, like things we know to be false. So 10 falsehoods, and at least 8 in 10 people were unsure or believed at least one of these things. And, belief in misinformation is really prevalent. So another survey showed that 33% of people think COVID-19 has killed thousands of otherwise healthy people. Now think about that for a second. That's a third of the people surveyed believe that. And 33% think ivermectin is an effective treatment for COVID-19, et cetera, et cetera. So these kinds of things are prevalent. And even people who thought they might be false were unsure that they didn't say they were definitely false. Only 30%, 22%, like a lot of people were in that green area where they said it's probably false, right? And these were things that were like vaccines cause autism, vaccines cause infertility, just really wild stuff. So now I think we need to just pause and talk about how there's misinformation and there's disinformation. And you hear these terms interchangeably, but they're really kind of not the same thing. They both entail the sharing of false information, but the difference between them is intent. So misinformation is just like when someone is forwarding something on Facebook that is definitely wrong, and they don't really know it's wrong, but they think that, and they saw someone else share it, so they shared it. But the intent was not to cause harm. They think they're helping most of the time. Disinformation is false information that's created and intended to harm and intended to misinform and intended to mislead. So the difference is the intent. And who does that, right? So in 2021, the Center for Countering Digital Hate did a report called the Disinformation Dozen, where they went through Instagram and looked at anti-vaccine content and kind of boiled it down where all of it was originated from. And they found that 12 people were responsible for creating most of the anti-vaccine information on Instagram. And why do they do that? Well, because they can use these social media pages as a storefront. There's a link in the bio. It's a huge industry, and it only increased over the pandemic. These people sell books, coaching, supplements, beauty products, telehealth. They prescribe ivermectin, just non-evidence-based treatments. And the nice thing about it is they don't need a sales force to sell their products or services because people share their posts for free, right? So some disinformation tactics that people use, and I'm going to go quickly through these because these are things that you probably already know, but there's some techniques that are that come up over and over that are being used to mislead people. And the most common are conspiracy theories, right? This is a Cornell University study where they looked at like 1.1 million misinformation articles and found that 46% of these were based just on conspiracy theories. And the most common conspiracy theories like miracle cures, the deep state, the Democratic Party, Bill Gates, whatever, all of these things were things that were being put out into the information environment. Cherry picking, data that supports a particular position while ignoring relevant contradictory evidence. And a really good recent example of this is the Florida Surgeon General has issued a warning about COVID-19 vaccines causing myocarditis and heart issues. But he uses data that's misleading and out of context. So he does present data from the Florida Department of Public Health on people that have had cardiac issues and myocarditis after vaccination, but he fails to produce from COVID-19, which shows like a 20 times increase over that of what people got from the vaccines. So it's out of context, it's misleading, and it is definitely cherry picking. Coordinated disinformation. This has really grown a lot. I saw during the pandemic is that there's articles and things that look like science that are really just planted in a journal that's supposed to look like a real journal. And then what happens is this misinformation that gets purposefully planted and looking like science then gets amplified by some dodgy media sources. And then those media sources get shared on social media and throughout echo chambers. And this is meant to cause confusion and chaos in an already bewildered public because we are getting information from all sides. But this is particularly egregious because it looks like a scientific article. Fake experts. We all know who these people are. Dr. Stella Emanuel up at the top, she was the spokesperson for America's Frontline Doctors back in 2020. We have Gwyneth Paltrow, and then who can forget in the 1950s, they had fake doctors posing, they were actors or models. More doctors smoke Camel than any other cigarette. So these are all fake experts, right? Either people on social media pretending to be an expert on something like Gwyneth, who has no health or wellness background. She's just decided to open a website. And, Dr. Stella Emanuel, who is an actual doctor, but she also believes in aliens and the Illuminati and all kinds of other things. So people are more likely to act upon and endorse ideas that come from an expert source. So disinformers know this, right? They use this to their advantage. And people often lack the resources to know if someone's really an expert or not, right? If someone came on and started talking about, carburetors in engines or something, I would probably think they were an expert because I don't know anything about that. So I would probably listen to this person, even if they were saying something totally like off base, right? So a lot of times these people say, we have secrets the government doesn't want you to know. There's some dodgy references in there or no references, no data anyway. They promote miracle cures or non-evidence-based cures like ivermectin during COVID. They have lots of anecdotes that appeal to your emotions, pseudo-medical jargon that sounds like science, naturalistic biases, like we don't want toxins or chemicals. These supplements are better for you. This kind of thing. Anything natural is good for you and anything man-made is bad, is a lot of what these wellness people try to push for you to buy their supplements or products or whatever. They like to claim that mainstream science is intellectually compromised, like we get paid to say the things we're saying, we get paid to publish in journals, all this other stuff. And then the claims of censorship. These people are being suppressed by the mainstream media. And you've heard them all, but that's basically a big part of creating the narrative because people know that people will listen to somebody that's put forth as an expert or a doctor. Logical fallacies, there are so many, but I chose one. the red herring, which is a kind of a misdirection that's used by misinformers. And this logical fallacy kind of uses parallel arguments that sound relevant, but are just meant to throw you off track, right? So here are some common red herrings that I get in my comments. So I might be saying in a video like COVID-19 vaccines are safe and effective. And then someone will come in and say, if you really cared about safety, you'd recommend ivermectin and not the gene therapy, right? So, just meant to throw people off. Anybody reading the comment, they just leave it there. So anybody reading the comment second guesses what I'm saying. Another one, you should use multiple mitigation layers to prevent COVID-19. And then somebody might inevitably come in and say, you never recommend people eat right and exercise. And that sounds like a good recommendation, right? Anybody knows that eating right and exercising is healthy, but does it prevent COVID-19? No, right? But it sounds like it's a misdirection. So it sounds like this person, has the right idea when they're just really trying to confuse. Black and white thinking is another one. And we also refer to it as impossible expectations. And this one we see and heard a ton during the pandemic, using not perfect as a reason to dismiss solid positive evidence, right? So like masks don't work, or using vaccine breakthrough cases, somebody getting COVID after being vaccinated, both of those things like as proof these things don't work. But in truth, no mitigation or therapy is ever 100% effective or 100% safe, right? We know this. So using multiple layers of things, the Swiss cheese model, which we've talked about before on my previous webinars, where if you line up these layers of mitigation, they work better. No one layer is going to be 100% effective. So the impossible black and white thinking was very prevalent. False balance needs special attention because much like the fake experts, this is used to sort of instill doubt in the predominant scientific standing on an issue. So when a scientific issue is kind of settled, or we have a lot of evidence to suggest something like the vaccine prevents severe disease and death, right? Presenting sources from quote unquote both sides as if the scientific community were split on the issue, it gives the impression that there's differences of the science is split, right? And it's misleading to the public because the science is not split on that, right? We have a lot of the overwhelming evidence suggests that the vaccines prevent severe disease and death. Do they have adverse events? Sometimes, yes, but the predominant the risk benefit is predominantly to get it. The vaccine adverse events are very rare, but people come on these big platforms like Dr. Drew's show or Joe Rogan's show and play up these extremely rare vaccine adverse events that happen in like 1 in a million people. And this creates a sense of false balance where it seems like there's two sides, and it quickly can erode public support for scientifically well-supported positions. So social media, again, deserves special attention. Now, because I'm an epidemiologist, this fascinates me because information on social media spreads the same way a virus spreads in a community, right? So you might have an index case, somebody that creates a piece of misinformation, and then it spreads to 3 people. Maybe this person up at the top decided not to forward it anymore. So that prevented all of these chains by this person deciding not to forward that incorrect piece of information. But the people that do causes all these extra chains of misinformation to start, just like a virus, right? So if a person double checks their facts or got their news from better sources, this breaks the chains, just like wearing a mask and not, social distancing, the same thing. The same types of things. You can break chains of transmission of misinformation the same way you can break chains of transmission on viruses. And misinformation tends to go very viral on social media. And that is because misinformation is very sensational, and people like to engage with sensational information. This video on the side, I always use this as an example. This person actually had a GoFundMe for vaccine injuries that was shut down because it was determined to be fraudulent. But her video had millions of views, and the social media platforms flagged it as false, but refused to take it down. And I'll explain why in a minute. So one of the tenets of public health, because I'm a public health scientist, so I care about this kind of thing, is that we want to change behavior, right? And to be more healthy behaviors. But what we have to do is meet people where they are. And so when a lot of my colleagues at the beginning of the pandemic were kind of like, sort of like, why is she making videos on TikTok? That's because people were in 2020, they were on TikTok and they were on Instagram and they were watching things. And that's where I wanted to make an impact. And as you can see here, about half of Americans in 2020 and 2021 got their news on social media at least half the time. So this is where people are, and that's where we need to be. And social media users, unfortunately, are more likely to believe false information about COVID-19 in this survey than people that got their information from newspapers, TV, doctors, and so forth. So for science communication, social media has been really great. I'm able to cover pandemic information that was coming out all the time quickly. I could make a video, post it, and tens of thousands of people would see it. It was a rapidly changing landscape, so it was a very quick way for me to communicate data and information to many people quickly. I didn't set out to do this, by the way. I just was responding to, I started making videos for my own friends and family and realized there was a real need for this when my videos were getting shared to networks way outside of mine, and they started really getting circulated. And that's when I realized that there was a real thirst for actual information and actual data. So some negatives to it is that the attention spans on social media are really fast. So people just scroll, and you're competing with all kinds of other stuff. Competition is fierce, and these algorithm-driven platforms, which very much contribute to infodemics and information fatigue. So social media algorithms basically work like this. Engagement, it drives how often you see specific content. So if you're a person that likes cats and you like a lot of pictures of cats, you'll see more pictures of cats. So someone engaging with certain types of content will be shown more of it. And this is what we were talking about, how they filter into echo chambers. Algorithm-driven platforms are designed to keep you on the app. So that is why sensational viral content will win out over me educating about like proper mask use every time. Misinformation will always win over the real data because it's sensational and it's compelling to people's psychology. And another thing that social media algorithms do is this concept of hyper segmentation. And so you sign up for social media, you give demographic information, your age, your, all kinds of things, where you live. And then you tell it a lot about yourself just by what you like and what you share and what you post and the hashtags you use and the people you're friends with. You tell a lot of information. So companies can pay the social media platforms for market research about you, and they can hyper segment into the smallest of categories to sell products and target products to people. And they use that information that they gleaned on you to sell things back to you. So it's a two-way thing. They get information from the social media platforms about you, then they use that information to target products to you. So how many times have you been scrolling on Instagram and you're like, wait, I do like that. I do like that. That's because they know what you like. So social media platforms want three things. They want engagement. So they want to drive usage to keep people on the app. They want growth to keep people returning and inviting their friends because they want more and more people and more information. And then they want advertising, right? So they want, as the engagement and growth happens, then more money is made from from people that are buying their data, advertising, and selling on their platforms. So sadly, also, social media platforms have really no incentive to do their part to curb infodemics and misinformation. And the reason for that is that platforms make money by traffic, whether it's good or bad content. And this is why that lady's video didn't get taken down with 11.5 million views, because they knew that video was performing well and was getting a lot of views and shares and likes. So that was good for them. So sadly, they cannot also be held liable for information posted on their sites, because in 1996, the Communications Decency Act was written, and Section 230 of that act basically says that social media platforms are not held responsible for things that are posted on their website by other third parties. So they don't have to take things down. And this was made, I have to plug my computer in 1 second, sorry. Okay, so this was made back in 1996, like during the time of, chat rooms, and, this was really not, social media as we know it didn't exist, right? So these platforms that we're talking about were much, much scaled down, blogs with comments, like we've definitely outgrown this, but they are still not held to any type of, they're not liable for anything people post. So they don't have to take it down. They can continue to profit off of it. So what happens when there's too much information? So let's go to the next stage here. So there's this sort of a scarcity mindset. Like some governments like to, shutter out information. Like North Korea is a perfect example. Like they want to control the narrative, so they shut out any information that's not what they want their people to see, right? And we don't do that here. But when you have too much information, it has the same effect, right? When you have enormous amount of complicated information, like COVID-19 science, immunology was difficult for people, right? People could kind of then get bombarded with a lot of information. So what did they do? They ended up just kind of choosing a worldview and filtering that information through that worldview. And with a surplus of information swirling around, all people really needed to do for people is cause a little bit of confusion, create doubt, sow a little distrust. They didn't really have to prove their case. They just had to muddy the waters enough. And then people could make a decision on what they think is true. And expertise no longer really mattered. And that's the problem. So we talked about echo chambers, how they confirm biases. People seek out news sources that reinforce their views. This kind of just shows that people that were vaccinated were more likely to believe local TV stations and national TV news. And we all heard this, listen to the mainstream media. Filter bubbles is another thing that happens. On social media, we seek out people that we like, right? We filter out ideas and people we don't like. We all have that one cousin John that we don't want to delete them because we don't want to cause drama in the family, but we've hidden their updates because they're sharing conspiracy theories, right? So we even do this ourselves. It's on both sides. 2020, we had only social media for camaraderie. We didn't have workplaces or social events. We didn't have these societal checks and balances where we would say, you know what, COVID's not real. And somebody could be like, what are you talking about? We didn't have that because all we had were these filter bubbles that we gave ourselves. And people shared our worldviews and we created our own information ecosystems. This then created informational divides. And this is because we were interacting with different information. So we all came up, different groups would come up with different conclusions, right? So a perfect example of this is like what the science says about masks, right? Anybody knows that is like looking at real science on masking and mitigations, that masks definitely prevent the spread of COVID-19, especially really well-fitting, masks, N95s, KN95s. We've seen that data. There was a Cochrane review that came out earlier in the year that was a meta-analysis, which that buzzword, people know that's the highest level of evidence on the evidence pyramid, right? But when you put bad studies or studies from different diseases, and this one was looking at masks, and it had some studies in there about flu, and it had some studies in there, like 2 studies I think were only from COVID, and there weren't many clinical trials which get rated higher on the Cochrane algorithm, right? So it's really meant to evaluate therapies and vaccines and things, not really behaviors like masking. But people that didn't like masks grabbed onto this and sort of started saying that, oh, this doesn't, because basically the report came to the conclusion that it can't really recommend or not masking based on the data that they had. And so people just took that to say masks don't work. And we have this highest level of evidence saying that. So the conversation is over. So you can see how when we're interacting with different information, it's going to lead us to come to different conclusions. And we both think our conclusions are science-based. So then there's these information voids that happen. And these happen when there's a lack of information about a topic. And what happens then is people start Googling and talking online. And then what happens is that there's this vacuum for misinformation to spread, potentially harmful narratives spread. And this is something that needs to be like proactively monitored for. So even good information can contribute to infodemics. So science communication failures happened on the US government side as well. So no one was really out facing the public, speaking in any official capacity to lay people about the pandemic. And that's, I think, why people like me ended up, getting more and more followers at the beginning, because we were out there doing that. And complex science was not being distilled down. And that, again, created this information void that allowed narratives to form. And people were overly focused on binaries, like you have to wear a mask, you don't have to wear a mask. Oh, now you do, again, have to wear a mask, instead of looking at the Swiss cheese model and saying, you know what, there's more infection right now, better idea to layer up. The conversation was focused on binaries. And instead of saying, we don't know, we need to look into this, people were silent on topics where they didn't have all the data. So that was confusion too, and allowed narratives to take over. So the traditional way that we did public health, like writing these tremendously big dossiers and then distilling them down to the public, really wasn't happening, wasn't working. And, these documents were still posted, these big, huge documents, but then, people were accessing them, not understanding them, using cherry-picked numbers out of context, creating narratives around them. And it was just kind of a mess. So I am the last person on earth that would say anything bad about the CDC, because a lot of my colleagues from my PhD program are working there, and they're incredible career scientists. But in retrospect, there's a lot of things that could have been done better. And there's a lot of things that I think are being done better now. Dr. Mandy Cohen is doing a tour around the country, talking to people, listening to people. She's on social media. So I think this is changing, and I think it's changing for the better. So let's just talk quickly about solutions, because I know I want to get to your questions. So infodemiology is the science of epidemics. And you probably think that sounds a lot like epidemiology, and there's a reason for that. So we have a science, we intervene, and we cause behavior change based on the methods of infodemiology. And basically, it is just like epidemiology. Like we said, information spreads the same way viruses spread, the same transmission patterns. This is the same. So in an epidemic of disease, we do disease surveillance. And in an infodemic, we do what we call social listening. And I'll talk about that in a second. So then in an epidemic, we have a virus, and then we have a disease. In an infodemic, we have a narrative that causes distrust, but both need to be intervened upon. So it's very interesting, because you can use epidemiologic methods the same way that you do on a disease on an infodemic. And social listening is really just used as, it's also called infovalence, and it's the process of identifying and assessing what's being said, about a product, individual, or something. So this is an example from Google Trends. There was a documentary, an anti-vaccine documentary called Died Suddenly that came out in November of 2022. And you can see the term died suddenly really wasn't searched at all until that documentary. And then there's like a huge spike in that people Googling that, right? So this is something that if you see this blip, you probably want to do something to counteract people thinking this, right? So this is a proactive thing that you constantly have to be looking at. So social media on science, so science communication on social media is key for public health departments. I think by this point, every department should be putting stuff out there. If possible, having a person answering people's questions on like a live stream is really important too. It meets people where they are. You can flood your community with good information, pre-bunk, debunk, and do some education on your platforms. I'm going to not go into this really super in depth, but using precise language is really important. The word lockdown got completely blown out of proportion during the pandemic because we never actually had a lockdown in the US, but people love to grab onto this word and use it all the time. And even if people are reinstating a mask mandate, people are calling that a lockdown. So just using precise language helps the information ecosystem. Pre-bunking is basically not waiting for bad information to come out to start combating it, looking ahead, predict narratives, and put good information out first. And then lastly, we want to target misinformation where it's spreading. We try not to give misinformation the mic. Don't give airtime to bad information. Repeating a myth, even to debunk it, kind of brings that information to a new audience. It's tricky, but just try to center the accurate information and not the misinformation when you're trying to explain something. And infodemic management, again, really important to be part of your pandemic planning strategies. And so in conclusion, infodemics cause overwhelm and confusion, information fatigue, and prompt inaction and indifference to public health measures. Infodemics lead to information divides, information voids, echo chambers, and filter bubbles. Social media amplifies misinformation and platforms make money. Epidemiological principles and methods can be applied to infodemiology and infodemic management. And infodemic management should be part of every pandemic planning strategy. And lastly, accurate and timely science communication directed to lay people is critical as information voids allow for vacuums that are filled with misinformation. Thank you so much.
Thank you so much, Dr. Wallace. That was great information and still very relevant, and hopefully things that we can learn from to help us prepare for the next big event that's going to be happening, because it's not a matter of if, it's a matter of when. We did have a couple of comments just about the role of politics and just how, this whole idea of misinformation, information, is it really a science versus political issue or something else, and just the role of government and government support for, doing research for information to help inform the public. So just a couple of comments about those. We did have one question from UAB, but as a librarian here at UAB, can you talk a little bit about how libraries, public and academic, can be partners in infodemics?
Oh, that's great. Yes, librarians are amazing because you understand the electronic, digital kind of information sphere a lot better than I do or anybody else does. So I actually did a presentation on misinformation at the National Library of Medicine earlier this year, and they're actually working on a lot of initiatives about that. So any librarian that's interested, I would suggest you hook up with them because they have a whole misinformation infodemic kind of initiative that they're working on. But yes, I think librarians are the experts in this area, actually.
We had one other question come in. How would you recommend people combat misinformation that surfaces by bad actors who comment on local health department social media posts regarding vaccine availability, safety, We struggled to justify our time to continue to respond to debug every comment that was based on misinformation. Any suggestions or tips on how to mitigate that going forward?
So I feel for you because I know in Chicago we have the same issue, and I used to see the horrible comments people would make, and I really just think you really kind of can't. I mean, you can delete comments if it's or you could just say, you can just set your if you delete comments, people then will say like, oh, she deletes anybody that doesn't agree with her. I get that in my stuff. So a lot of times if it's something, I have my comments set to like, I have to be following the person to make a comment on Instagram and on Twitter, because those are the two places I tend to get the most abuse. So you could do something like that, but you're right. I mean, a health department doesn't really have the time to go through every troll comment, because a lot of times the troll comments are just somebody that's got a lot of time on their hands and you don't, right? So I would either just change your settings, or, you really just kind of can't. All you can do is just keep putting out good information, and, people are going, trust me, I know people are going to keep doing that, but it's more important that you focus on, like you said, putting out good information and kind of flooding the good information in the environment, rather than wasting your time on one troll that's got all the time in the world on their hands. There's no end to the energy on that side of the equation.
She's like, correct. There's typically a very select few bad actors that those comments are from. And
exactly.
I know our health department has turned off all comments to their social media posts.
I mean, it might be a good idea, just because if you are spending a lot of time even reading it, it's just not really worth your time, right?
Another question we had coming in: when someone suggests that we should not trust any information, any info sources connected to the government, how can we respond?
Yeah. So I get that a lot. Like I listen to the government, I listen to the mainstream media. And so really what I say is that the people that work for the government are career scientists, and this is what they do. And there's no, I mean, anybody that thinks somebody that goes into public health to make money has another thing coming, because none of us do that for that reason. So people that what I say on my side is that the people at the CDC are career scientists, that they know what they're doing. A lot of them were in my program. I am, I know what they know. I know what they've learned, and I trust them. So I think that there is a lot of political stuff that's changed the way people view government agencies during the pandemic, which is unfortunate because there are a lot of really talented folks. But another thing I try to do is focus not just on like the government says this, is I try to focus on the body of evidence that is being used to make these decisions, right? So whether or not you want to listen to, Dr. Cohen or Joe Biden, like, just think about the body of evidence. So we have a lot of evidence showing that the vaccines are safe and effective, that they are, preventing death, they're preventing severe disease. We have data on this, right? We have a lot of data on it. We don't have a lot of data on the things being said on the Joe Rogan podcast, on that side of things. So those kind of things that people are planting out there in the information ecosystem to sow distrust, there's no data to back them up. There's no data to support it. So what I say is there's a reason why the government is going with this information, because there's a lot of data to support it. So if you talk about that, it's a little bit more, it's less like you should just believe what people are telling you to believe,
I think that brings us to the top of the hour. So we would like to thank everyone who attended. Just as a reminder, this webinar is being recorded, and a link to the webinar, the evaluation, and also our website and the slides are going to be sent to all registrants. So please be on the lookout for that within the next week. And we hope to see you for our next webinar. Thank you so much, Dr. Wallace.
Thank you.
Really appreciate you being here. Great presentation. Thank you so much.